The first thing to think about in treating people with functional tic disorders is to learn what functional tics are. This is often referred to as psychoeducation, and now there's quite a lot of information around about functional tic disorders. The key thing to do is understand what they are, how they present, and how they change over time. Perhaps it might be good to have a look at the video that Morven has on this website, which describes a little bit more about functional tics and neurodevelopmental tics. There's quite a lot of information available on the web about this as well. Once a family and a person with functional tics understands a little bit more about them, then they can really start to adapt and change parts of their life in order to cope and deal with these. To date, we don't have research studies showing us which evidence-based interventions are best to use, but we understand that perhaps treating additional difficulties such as anxiety or trauma may also be helpful. We know the kinds of interventions that work well for neurodevelopmental tics are comprehensive behavioural intervention for tics and exposure with response prevention. And in both of these conditions, there are elements that we have seen to be quite useful in helping people with functional tics. In particular, looking at reinforcers. So these may be triggers that seem to occur most when tics respond, but also consequences that may occur afterwards. So an example of a consequence may be people responding to the tics, perhaps people commenting on them or reinforcing them, such as allowing a person with functional tics not to do their homework or chores around the house, or responding to it, making comments, or perhaps laughing. So one of the things that may be useful in working with your health professional in managing these functional tics may be looking at these reinforcers and how these can be changed in the young person's life in order to reduce the number of tics they have. One of the things we have been finding in people we've been working with functional tics is once they understand more about the tics, what they are, and in particular what tends to trigger them or maintain them, then this can be really helpful in reducing the tics. Sometimes it can be helpful to start with supporting an understanding of the tics and then move more into a treatment such as cognitive behavioural therapy if anxiety has been identified as one of the maintaining factors in keeping the tics going. So again, this will be helpful to discuss with your clinical team. This could be a psychologist or another mental health practitioner.